Welcome, everybody. Today's topic is the power of GLP-1 in weight loss therapy for cancer survivors with Debbie Benson, MSRD, CSO, and CLT. The description is discover how GLP-1, a hormone crucial for appetite control and blood sugar regulation, can naturally support weight loss. This presentation explores simple ways to optimize your body's GLP-1 levels, as well as how GLP-1 medications work and how to enhance their effects through diet and lifestyle. Debbie Benson is the Nutrition Outreach Manager for Holy Name Medical Center and has over 25 years experience as a registered dietitian with broad experience within the field. Debbie is a friend of Woman to Woman. She was a Woman to Woman reunion presenter, and I am thrilled for you to join us. Thank you. The floor is yours.
Thank you so much, everyone, and thanks for joining on this gorgeous day. I see someone's enjoying it outside, I hope in a park or something. So today's topic is very relevant to right now, and I'm going to give you all the information that we know so far, because this is a very changing field in terms of research. There's a lot of research going on. I don't have all that data. So just keep that in mind, and also keep in mind that I am not here to tell you should be on it, shouldn't be on it. I'm just giving you the facts, and this is a prescription medication, so it would be inappropriate for me to be making these recommendations. So just know that. And there's a lot of nutrition involved. We have an outpatient nutrition center here, and we have a lot of patients on it, and we're finding that the doctors are just kind of giving it to them without too much guidance. And the guidance, I think, is very important, as like anything else. So here we go. Let me share my screen. Okay, so let's get started. The objectives for today are understanding what GLP-1 is, both natural and medication, how different aspects of nutrition affect the progress of utilizing GLP-1, quality, quantity, nutrient balance, and frequency, how digestion is very important for creating your own and helping out the medications, some meal planning guidelines if you are on it or if you want to enhance your own, hydration, which is kind of a lost thought on importance of nutrition. So hydration meaning water intake or fluid intake. We're going to be talking about some supportive supplements, and then we're going to actually get into the medications, the side effects, and also how it affects cancer treatment, and cancer survivorship and risk. So what are GLP-1s? I'm sure many of you heard of this, but did you know what it actually stands for? So it's actually called glucagon-like peptide 1. And these are things that are natural to our bodies. We have them. So the medications is a super duper dose of our own natural GLP-1s. GLP-1 is produced by special cells in the intestine, which is why having a healthy gut microbiome is really important. It stimulates the pancreas to secrete insulin, which is important to manage the carbohydrates and glucose that you're eating. It helps lower blood sugars that way. It slows the rate of digestion and motility so that it gives you a full feeling, which is important. And this is why people aren't eating as much, because they're feeling full. And it regulates blood sugars. It affects appetite. It reduces cravings. And the P part of this is a peptide. So it's an amino acid. It's very specific functions. So it's an amino acid with very specific functions. Did anyone ever hear of GIP or GIP? That's kind of like it's another peptide hormone that acts a little bit differently, but just so you know that term, because it may come out. Some medications have both, but predominantly it's the GLP-1. And the GIP, the few differences so far that we know of in research is that it has more to do with the breaking down of fats. So just for your knowledge. So optimizing GLP-1, whether it's your so let me explain that when you eat food, the food will signal your intestinal cells that create the GLP-1 to create the GLP-1, which will then go to different sites in your body. One of the pancreas to affect the insulin, one in your brain to make you feel full. And even they're finding other areas of your body. There are GLP-1, what they're called receptor sites, which there go. Now, naturally, it only lasts for a few minutes, they find in research, after you eat. But the importance is there. And that's why they created a medication, a once-a-week medication that is, you are like really upping your GLP-1 all the time. And this is essentially how it works. It gives you that full feeling. It reduces your thinking of your food. And so people eat less. And that's really the magic of it. It's you're eating less. And so just like bariatric surgery, bariatric surgery is, reducing your stomach or a rerouting. And that actually increases GLP-1. But for the same nutritional program that you have to follow after bariatric surgery is pretty much the same that you have to follow here, because the concept is the same. You're eating less, so you need to prioritize your nutrients and your food, and protein becomes more important. And the weight loss is fast, so the muscles become more important. And I'm just telling you that just so that you can know how important the nutrition is to GLP-1. In fact, right now, insurance companies are requiring that anyone who goes through bariatric surgery sees a nutritionist for a certain number before they are allowed to have the surgery. And I'm hoping in the future that's the same thing with GLP-1s, because it's the same thing. You need to relearn or learn how to eat so that you don't get sick, so that it works well. Anyway, that being said, the 4 key areas of optimizing your GLP-1 is quantity, how much we're eating; quality, what are we eating; nutrient balance, both macros and micros; and frequency, so timing. We can do a little bit intermittent fasting, things like that. So I'll get into the details. So we'll talk about quantity first. So quantity, there's such a thing as too much, there's such a thing as too little, and there's such a thing as just right. And it's hard to get that just right. Giving, too much at one time, even if it's healthy foods, it can overwhelm your system and keep it from functioning properly. Giving it too little will keep it from functioning optimally too. So you don't want that. It could affect your metabolism, and you've heard of yo-yo dieting affecting metabolism and then really being difficult to lose weight in the future. And giving slightly less than what you need is the best strategy, but you have to do it very responsibly with what you're inputting. Okay. So I'm just going to give you a little example of how we do this, like how we figure out. Now, this is just math. Our bodies are not just math. Our bodies are so complicated, but without very expensive equipment and, these like oxygen bariatric, chambers where you can really find out how many calories you're using, you can't do that with everybody. So we do have some really simple equations, and this is the one that most dietitians use. So in 1 pound is equal to 3,500 calories. That's what they're saying. So 3,500 calories. So if you want to lose 1 pound for a week, you have to subtract 500 calories every day to equal that 3,500 calories per week. Does that make sense? So to figure that out, I use a very simple equation. There's some more complicated ones, but I found when doing both that they came out to the same. So I'm sticking with the very easy one. So you take your weight and you divide it by 2.2 to get a kilogram. And then you multiply that kilogram by 25. And then now this doesn't include 25 is kind of like a stress factor that does not include exercise. So if you're exercising, you're going to have a bit more of a reduction because of the calories that you're expending. So for the example, a 200-pound person is about 90 kilograms, and times 25 would equal 2272 calories minus 500, comes out to about 1772 calories a day to reduce your weight by 1 pound per week, which is healthy. We like slow. Slow is very important. Now, it's not going to be so slow when you're on these drugs, but we still do like slow. Quality is so important. I wanted to show you what processed and ultra processed means, because I know ultra processed especially has been thrown around in, like, stories and media. And I don't know that everyone exactly knows what it means, because it's not really regulated what it means. So minimally processed means, something fresh, something fresh. Like for the example we'll use is corn. So a cob of corn, or frozen corn, it would be minimally processed. Processed would be canned sweet corn. They're adding a little sugar that's canned. And ultra processed is they're taking that corn, they're really processing it in machines to create a flour, to add spices, to add fat, and create a corn chip. So that's a very good example of what minimally processed, processed, and ultra processed is. And I'm sure that ultra processed foods is something that you want to limit, really limit, like as an occasional, because that's where you're getting all of the chemicals and the bad fats and the inflammatory fats, and it's not really a food anymore. So, obviously like processed foods are okay. You're going to process a food. You're going to cook your chicken. You're going to season your chicken. You're going to have applesauce, which is fine. So I'm okay with processed foods. It's the ultra processed foods that are really something that you want to limit in a big way. Okay. Those are treats. So when you are eating even just your produce, you want to really pick out the best of the best. So I do use certain guides. I know I've mentioned these guides before, but they're worth mentioning again. This is from a website that I really like. It's an organization called Environmental Working Group, and the website is ewg.org, and they do a lot in terms of really looking for the cleanest of everything, not just food. They do makeup, they do cleaning supplies, they do water, but my focus is food. So I love their Dirty Dozen and Clean 15 list, which actually I think if I click on this, I can go to it. Yeah. So this is what it'll look like. And it changes every year. Every year, this group, sorry, always asking for money. This group will take conventional produce, wash it normally like you would do at home, and measure their pesticide content. And they'll come up with a list of Dirty Dozen, which is the top 12 that are the highest in pesticides. And they're usually similar, but maybe in different order every year. And these, if you're eating them often, I would recommend buying them organic. And I'm noticing that organic prices and conventional prices are not too far apart lately. We'll see in the future, but lately. So I do think it's worth it. And just, make the decision based on if you're only occasionally eating strawberries, it's not going to make a difference. But if you're having strawberries every day, or apples, I think apples is on this list because it always is. Oh, it's not on this list. Okay, pears. If you're having pears every day, then consider getting them organic. And they also have a Clean 15 list. This continues on the list. Clean 15, don't bother spending extra money getting these organic, because they don't have too much pesticide on them. So this would be quality versus, not so great. Let me get back to my presentation. Okay. Some other aspects of quality would be fish. Certain fish like salmon, it's been researched that the wild caught has less mercury and more omega-3s. So you want less mercury, you want more omega-3s versus the farmed. That might be a little bit harder to find, or it'll be a little bit more expensive. So again, it's a matter of, do I eat a lot of fish? Many people don't know that canned salmon is almost always wild, and it's inexpensive, and it's a great fatty fish that you can add to, to salads or to grain bowls, or, on crackers. Grass-fed dairy and meats, no hormones or antibiotics. Sometimes the description will say grass-fed and finished. Those would be ideal. Again, if you're eating these frequently, it's something that you really want the best of the best of. The Environmental Working Group also has a seafood guide. A lot of people ask me about seafood. They're afraid. Some people are afraid to eat seafood because of the mercury, but it's just, about learning which fish has the higher mercury. And this guide is great. You can put your height and weight in there, and it'll ask you other questions about heart disease, and it'll give you the fish that you should be buying more often based on those results and the amount of mercury in fish. So that's on the same website. It's this one.
Debbie,
And
there is a question in the chat, and I just want to bring it to your attention because
so
it's
I
about the
can't, because
name.
of my
Oh no, I'll read it to you. I'll read
yes,
it to
thank you,
you.
thank you.
So Bonnie asked, "What is the name of the group?" The EWG. I think EWG. If you
Yeah,
can just explain it,
sure. It's called
since we're right
environment.
here.
Yeah, sure. It's
Thank you.
environmental. Should I type it in, or I can't see? I don't have access to that right now.
I think if you
Right.
just say it again, that's perfectly fine.
Environmental Working Group,
Thank you.
EWG. It's really great resource for just, really double checking what your chemicals that are in the things that you do daily.
Okay, I
Here's,
wrote it in the chat. Thank
thank
you.
you, thank you. Here is a list of chemicals and things that you might find in the ingredient list that you should be avoiding. Not at all costs. I don't like to scare anybody. I don't like to stress anybody. But again, it's what you do frequently. So once in a while, if you're having some of these, no worries. But if you're constantly, you know, putting these things into your body, you want to start paying attention, because these days there's always an alternative to a food that might be super processed, that some a really great organic company will take it. I've seen that a lot. I've seen that in crackers. I've seen that in chips. I'll just give you one example. Most chips are made with seed oils or canola oil, and if you eat these a lot, they may cause inflammation. They're more inflammatory. They upset your ratio of omega-3s to omega-6s and 9s. But there are companies, they do cost more, but there are companies that are making chips, potato chips, sweet potato chips with olive oil, coconut oil, avocado oil, and they're really good. And so you do have alternatives, but try to avoid artificial colors, sweeteners, artificial sweeteners, because even though they don't give you calories, they do upset your microbiome, and they can trick your brain into thinking that you're getting sugar, and a whole cascade of, bodily systems kind of, follow into that. Blue dyes are awful. Most of these dyes are banned in other countries. I don't know why we still allow them. Tartrazine, sodium nitrate and nitrite, BHA, BHT, potassium bromate, BVO, BPA, and carrageenan. I mean, carrageenan has been in the news a lot lately, so most companies are willingly taking it out. And I've even seen some almond milks that say on the bottle, no carrageenan, because they know that consumers are looking for foods that don't have this. And carrageenan has been shown in research to upset the microbiome, to not be good for the microbiome. That was the biggest issue with carrageenan. So now let's talk a little bit about nutrient balance. And this pertains to both macronutrients, carbs, protein, fat, but also micronutrients, which are vitamins, minerals, antioxidants, fibers, and fatty acids like the omega-3, 6, and 9s. And so first, like the balance of carb, protein, fat is important, especially if anyone has diabetic, or has or is pre-diabetic, or even just for for wellness. It's important to get a good ratio of all those three, so that your blood sugars are in check, and the addition of the fiber is good for your microbiome. And just for some examples of unbalanced versus balanced, and I find breakfast to be the least balanced of all of it's harder to balance breakfast because of the protein if you're not eating eggs. So to balance oatmeal with fruit and sugar, a lot of people do it this way. And some people do the quick, and even if you're not doing the packets with the flavor, which is really high in carbohydrates and sugar, even if you're doing the 1 minute, which I get, it's nice and convenient, but even the shaving of that oatmeal versus an old-fashioned oat makes a big difference in your glucose response. And they've done research on this. So even just eating old-fashioned oats, or they might call it old-fashioned oats, or I forgot the other word, but you could still microwave it. It just takes another minute and a half. It's not that much longer. But because the oatmeal is a carb, you want to balance that out with some protein, some fibers, or some healthy fats. So instead of adding fruit and sugar, you can add a little fruit, but make sure you put some flaxseed, ground flaxseed, or nuts, or or nut butters, like peanut butter or almond butter, or cinnamon, because cinnamon doesn't add any calories and it does have a glucose lowering effect. Another example for lunch would be a turkey sandwich and potato chips. So that's bread, two breads, or a turkey sandwich and let's say potato salad or macaroni salad. So now we're talking about two slices of bread and a carb, where really you want to just pick one or the other. So instead, you can have half a turkey sandwich with avocado, healthy fat, high fiber, with lettuce, tomato, and a salad. So here you are really reducing the carbs and, even more important, increasing the nutrients, because avocados, tomatoes, lettuce, they all have great micronutrients, the vitamins, the minerals, and fiber. Dinner, chicken with rice, beans, and corn. These are things that I'm hearing a lot of people are eating, my patients. So instead, chicken, the protein, great, with brown rice. So you just want to take that white rice and buy the version that has more fiber. So that would be brown rice, or you can swap it up for quinoa or some other kind of high fiber, whole grain. Adding beans is great. I love beans, nuts, and seeds. To me are like the perfect little food because it has everything. It has carbs, it has protein, it has healthy fats, and it has vitamins and minerals. So I love recommending beans in a salad, or beans in your rice, or beans and chili. It just like nuts and seeds, we want a variety. So, and they could be canned. They could be canned. I love my canned beans. I just rinse them and I put them in so many different things. And just like I want you to have a variety of different, fruits and vegetables, also beans and nuts and seeds, you want to not always buy the same one. So buy garbanzos one week, buy black beans another week, buy kidney beans another week, really, because they're going to give you different nutrients. Some more examples of nutrient balance. So another very typical breakfast is toast with jam, carb. Instead, do whole wheat toast with avocado and tomato, or an egg. Eggs are great for balancing out any kind of, sometimes I have people eat, an oatmeal and an egg and one hard-boiled egg, or toast and an egg, or a waffle and an egg, because the egg is very good at balancing out that carb because it's only protein and fat. A lunch example would chicken salad sandwich with a side of macaroni salad. Instead, you could do chicken salad on a bed of lettuce, tomato, onion, cucumbers with a side of corn chips. Organic corn chips made from avocado oil. A plate of pasta with tomato sauce and garlic bread. Carb. I mean, it's all carb except for the tomato sauce. So instead, maybe either do a whole wheat, or, there's those really great bean pastas out there. I love the chickpea and lentil pastas. Great option, because especially the Barilla, when you look at the ingredients, it says chickpea flour. So it's only a chickpea. So it has the protein, it has more protein and fiber than like a regular, even whole wheat pasta. With tomato sauce, add some protein, some shrimp, some chicken, some beans, and some kind of green, some spinach. That would be balanced.
Debbie, quick question.
Yeah.
Bonnie is asking in the chat, in terms of breakfast, for this, is steel oats best? Steel cut oats best.
Steel cut oats is best, but I know a lot of people don't have the time and don't like it. So I think old fashioned is also a good option. But yes, steel cut oats is going to be even slower because of the how long does it take to cook steel cut oats? Does anybody know? Like more than a couple minutes. The longer it takes to cook something like brown rice is 45 minutes or 40 minutes versus white rice, which is 15 minutes. And that's because of the fiber that's in there. So it's a good thing. So you can find shortcuts, like you can find steel cut oats that are already cooked and frozen, or in I know Trader Joe's has that. Trader Joe's also has brown rice that's frozen that you can buy and just microwave it. So you can find shortcuts for these very healthy foods if you don't want to, spend the time. So yeah, steel cut oats is great if you like it and if you have the time. Any other questions?
That was it in the chat. Does anybody want to ask Debbie a question right now in terms of anything she's covered?
Now we're going to talk about frequency. So this is kind of like an intermittent fast, like I mentioned before, but there's options. There's not one way to do it. But you gotta, eating every 3 to 4 hours is important for two reasons. Number one, I like the break, but not too much of a break. So the break is good because this is how long it takes you to digest, and you do need a break from digestion. You shouldn't be digesting all day long. But I don't want you to go too far either because wouldn't want it to affect your metabolism, and I wouldn't want you to be starving at any meal. You don't want to be starving at any meal. You want to be hungry, pleasantly hungry at a meal. So my ideal uh, is an 8-hour eating window. I find that people do well with that for weight loss. And so that would mean before 10 or whatever 8-hour window you pick. So if it's 9 to 5 or if it's 11 to 7, that's okay too. That means before that hour, you're only maybe consuming water or coffee, tea without any calories, no sweeteners and no milks, because you don't want to start your metabolism before. And then after your last meal, which is either 6 or 7 or whenever you finish, the same thing. You can have teas, you can have water, it's encouraged, but you don't want to have a calorie. So 8-hour eating window, if you're really ambitious and you really want to, try for that weight loss. 10-hour eating window is good, is almost just as good. 12-hour eating window, a lot of people find it's easier to do. And I would add a snack to the 10 and 12-hour window so that you're not exceeding that 3 to 4 hour window between the snack and the meal. Does that make sense? Digestion is, the key to everything. I mean, I always talk about the microbiome and digestion, and with this topic, it's just as important too. Optimizing your digestion is really, really essential because this is where GLP-1s are made. And this is where the receptors have to be. So if you don't have a healthy microbiome, a healthy wall of your GI tract, it's not going to work well. So some tips to improve digestion. Chewing is so important. Not only does it slow you down so that you're not, missing those hormones because you're eating too fast that tell your brain that you're full, but also as the more you chew, the more you're breaking down your food, it's easier to absorb that way. And saliva has digestive enzymes naturally. And so it'll help the breakdown of your food and the absorption of the nutrients. So chewing is really important. I would just try to go for the consistency of oatmeal, however long that might take you. But I mean, I'm a fast eater, and I know I could probably swallow something after chewing it twice, which is terrible, and I'm working on it. But you don't want that. You want like a nice, mush in your mouth before you swallow. Sometimes digestive bitters, which if you don't know what that is, it's a very natural herbs, a mixture of herbs. Usually it's things like dandelion, it's ginger. It could be if you can make it yourself, or they actually sell tonics of digestive bitters. And I would recommend something like a little capful before your meal. And this kind of alerts your organs, your gallbladder, your pancreas, your digestive organs, that food is coming. So it's natural. That's why, and I guess in history, people have been, sometimes would take some ginger before a meal. And it's it's a really great habit to get into if you want to, and you could do it naturally, or you can buy something. Some people have issues with digestion, and because the pancreas is involved when you're taking the medications, the GLP-1 medications, it could affect how much digestive enzyme is produced. That's mostly where your digestive enzymes are produced and let go. And so some people, if they're complaining of gas or bloat, I do a trial of digestive enzymes. You take them right with your meals, and they help break down your food too, carbohydrates, protein, and fat. And then there's eating prebiotic rich food, which I'll show you on the next slide, probiotic rich food. And an antioxidant rich food called polyphenols has been studied to be so super healthy for your gut. And it's in a lot of foods. I'll show you, you'll definitely be able to incorporate it into your day-to-day.
Yeah,
And so it helps.
Debbie, a question. What if you already have a slow digestion?
A slow digestive tract.
Yes.
So like a gastroparesis.
Yes.
So that's if you're in terms of GLP-1 medication, that's something you got to talk about with your doctor. They might not recommend that for you.
Okay.
Because you're already at that point. Okay, so let's get to the foods. Okay, so fiber. Okay, I got to give fiber a big shout out. Fiber is one of the easiest additions to your diet that do so much. They help lower your blood sugars. They help improve your gut microbiome. They help lower cholesterol. And there's probably more, but it's such a simple thing and it's in a lot of food. And honestly, I even recommend fiber supplements at times, especially when people have goals of like reducing their LDL or their A1C or they're having constipation. I'm a big fan of fiber, especially from food. And so we'll go over some of them. Now, it is recommended, especially if you're on these medications, that you increase your fiber to get in about 5 grams of fiber at a snack and 8 grams of fiber at a meal. Typical American diet is 15 grams, and the recommendation is 25 to 30. And I've recently read some research that suggested that if you are having 50 grams of fiber, which is really almost impossible, 50 grams of fiber a day, you will never be diagnosed with colon cancer. That's how, important. Oh, so I forgot the cancer risk part of it. So that's a big one too, is colon cancer. But 50 grams of fiber is a lot. But aim for at least 25 to 30 for the day. And remember that when you increase your fiber, because fiber does use water to absorb, you should be definitely increasing your water. And I would not add all of these foods or supplements at the same time. You want to increase it slowly so your body gets used to it. Raspberries are one of the highest fiber containing fruits. So just a couple of raspberries, 8 grams per cup. And raspberries are also a polyphenol, which I'll show you on another slide, but it's also, so it's a 2-for-1 because it's high in fiber and it's a polyphenol, which is gut healthy. Artichokes is also pretty high. I recently found in Trader Joe's frozen artichoke quarters that are unseasoned. You can do whatever you want with them. I usually just roast them and they're delicious. And they're not that expensive like buying the whole artichoke. Whole grains have a fiber over, a simple carb like white rice. Barley has 6 grams. That's one of the higher ones. And seeds, chia seed, flaxseed. I'm always recommending ground flaxseed as a fiber source. Pulses like lentils, very high. A lot of people, if they're not used to eating lentils, they have trouble digesting them because they are so high. So that's one that I would definitely increase slowly. Some more gut healthy foods. Let's talk about probiotics first. So probiotics are foods that are fermented. So those are things like sauerkraut, kimchi, kombucha, which is a fermented tea, kefir, which is a fermented dairy-like yogurt, but it's even higher because of the way it's made. It's even higher in probiotics than regular yogurt. Lassi, which is an Indian yogurt drink. Natto, which is a soy product that's fermented. Miso, the same thing. And then pickles and tempeh. Now, the sauerkraut and pickles, you might find them in the supermarket, but if they are not fermented with salt, then they're good and delicious, but they're not going to have probiotics in them. It's very easy to ferment your own pickles with thyme and salt and lots of flavorings and some good, cucumbers. I do it all the time.
Thank you. I'll see you later.
Prebiotics are fiber-rich foods which help feed the probiotics. So they're prebiotics. And they come in all different forms, vegetables, fruits, grains, onions, garlic, artichokes, bananas, the green bananas, and asparagus are one of the higher foods that contain prebiotics.
There's a question in the chat from Melissa. She's asking, are the seeds themselves supposed to be round always? My GI doctor said that seeds can also cause intestinal issues.
So he's probably referring to diverticulosis or itis, when you have the little pockets in your intestines and these seeds can get stuck in them. So I think your question is the whole, so chia seed you wouldn't find ground because that's something that absorbs water. And there's been a lot of research that shows you don't have to avoid seeds when you have diverticulitis or itis, yes, osis, which you have the little pockets because it doesn't really make a difference and you're really missing out on some really good nutrients. But if you're worried, I would buy the ground flaxseed, which I would anyway, because the whole flaxseed is the skin is very, very, very thick and you can't really absorb the goodness inside. So I would always buy that ground anyway. And the chia seed is, as long as you're eating it with water, it's going to turn into a gel. So you're not really going to have the seed to get stuck in the pockets. I'm a big fan of seeds, pumpkin seeds, sunflower seeds. They're nutrient dense and they don't have a lot of calories. And it's just a great way to get some vitamins, minerals, and antioxidants.
Thank you. And there's one other question, but I think you might get to this more towards the end. The question is, what are GLP-1 med side effects?
Oh, yes, we have a whole list.
Okay, great.
That's coming. Don't worry. I'm a food first person, so I like to talk about food first, but yes, absolutely. So polyphenols, I think I just mentioned that raspberries is really high in. It's a plant-based chemical and it's really high in antioxidants and it's anti-inflammatory. And it helps the gut bacteria get to a really, really good mix so that it does what it's supposed to do, which is it doesn't just digest. The gut microbiome, all those microbes in your gut, they don't just digest food. They have so many more functions that they're learning every day a new function. So if that's healthy, then you can be as healthy as you can. And here are some very good examples of polyphenol rich foods. There's one here that that's not here that I want to tell you about, and that's green tea. And I'm a big fan of green tea because not only is green tea high in polyphenols, but it also has a lot of really great studies for cancer prevention. So I'm a big fan of green tea. The next couple of slides is going to be like—
I'm so sorry. Can I interrupt you for one quick sec?
course,
There is a
yeah.
question I missed. Allison asked, thoughts on making bread from ground nuts, lentils?
From ground nuts and lentils? Great. If you can, yeah, I mean, why not? There is a company called Pacha that makes bread out of buckwheat and only buckwheat. And I've tasted it. It's pretty good. It's frozen. It's very tiny and very expensive. But so if you can make your own, even better. Yeah. Send me the recipe if it comes out good. So the next couple of slides is going to be meal planning. Like, how do you get your meals together to balance, to do the balance that we talked about? First of all, there's two different ways we can talk about this balance. One of them is the example shown here. Each meal or snack should be 15 grams of carbs, 7.5 grams of protein, 5 to 15 grams of healthy fats, and an unlimited amount of non-starchy vegetables. And we're going to go through what that is because some people don't really understand what non-starchy vegetable means. Or sometimes I do a breakdown of carb, protein, fat as 40, 30, 30. So what does that mean? It means that if you are on 2,000 calories per day, 40% of that is going to be carbs, 30% of that is going to be protein, and 30% of that is going to be healthy fats. So does anybody have any questions about that? And then to calculate how many grams of carbs that would be, you would take that 2,000 calories, take 40% of that, divide that by 4, because there's 4 calories per gram, and that would give you the grams. And I think it might be around 150, and then like 100 grams of protein. And because fat has more calories, it wouldn't be 100, it'd be more like 60 grams of fat. But this is don't worry about that. It's just a nice little way of showing you that, your carbs and protein aren't going to be equal, but they're not going to be that far apart either. And this is for weight loss, because typically the carb is about 50, 60%, and the protein is 20. But this is a good ratio for GLP-1s and for weight loss. Non-starchy vegetables are awesome. They have lots of nutrients, they have fiber, and they only have 25 calories per serving. So that's why we say unlimited. If you fill half your plate up with these kind of things, because it's not going to affect your weight. It's going to make you feel full because of the fiber and the water, because a lot of it is these vegetables that have a lot of water. And you know, artichokes are so like when you look at an artichoke, it kind of looks like it would be a lot of calories, but it's not. It's 25 calories per serving, which is like half a cup or a cup. A lot of people think eggplant is caloric, but unless you're, you know, frying it up and breading it, it's not. It's a non-starchy carb, so you can have as much as you want. And so, yeah, look at this list and
Fresh.
fresh. Is that a question? Okay. Cabbage, carrots. I mean, you know, there's a whole list here. A serving is typically 1 cup raw or half cup cooked. But remember, don't even measure these. You want more. Nuts and seeds should be measured out because they do have a lot of calories. Not more nuts than seeds. And here is just typically what the serving should be. So cashews, almonds, all those nuts is about 1 ounce, which is like a little handful. Macadamia nuts are 10 because they're higher in fat. Hazelnuts are 18 because they're lower in fat. Brazil nuts are 3, and that's not only fat content, but it has a lot of selenium. You can actually overdose on selenium if you have too many Brazil nuts. And then hemp, all the seeds are about 2 tablespoons. Walnuts, 10. Non-dairy milks, with like coconut milk, walnut milk, almond milk, oat milk, about 1 cup. And nut butters is 2 tablespoons. Because fruit has fructose, that can't be unlimited like the non-starchy vegetables. So, you know, look, I usually suggest between 2 and 3 fruit servings a day, not all together, spread out. And the typical portions are 1 medium apple, half a banana, unless it's very small, 15 cherries, 1 cup of berries. Berries are low glycemic, so you can have more of those. Same thing with the apple. Grapes are high glycemic, so you got to count those, about 15. And papaya is low glycemic, that's 3/4 cup.
Avocado, olives.
Pineapple, 3/4 cup. Watermelon, 1 cup. Then there's greens, and the serving size is going to be about half a cup cooked, already cooked. Sometimes I also use my fist as a portion, you know, just this is about half a cup. So if you don't want to measure, you could just use your fist. Or I will say 1/4 of your plate should be grains. And you want the best of the best, just like, you know, we talked about quality. We want grains that have fiber and protein. You know, whole wheat versus white is always best because you get the nutrients. Then there's starchy vegetables, and those are things like corn, peas, potatoes, sweet potatoes, and the serving size is the same as a grain, which is half a cup. Proteins, it's about 3 ounces prepared, but I always allow a little bit more protein because it is filling, and you do need more protein when you're on GLP-1s or if you're trying to lose weight or eating less, you do need more protein because you do not want to lose muscle mass. And that's what might happen if you don't eat enough protein. So that there's fish, seafood, meat, and eggs. Fats, are, you know, they're important. So don't miss out on the fat. It's not, low fat diets don't help because fat is very much needed for nutritional absorption, for your organs, for your brain health. So you want to limit it because it is a source of a lot of calories, but you don't want to skip it. And you want to choose the anti-inflammatory fats like olive oil, avocado oil, coconut oil, and then the fats from the nuts and seeds. Then there's the beans. We already talked about the beans, but I mean, beans are awesome. And here is a whole list of different ones that you can try. I know a couple of my patients recently told me about Bob's Red Mill has this great soup mix with, you just have to add the water kind of a thing. And it's got all these great beans in it. And they said it was good. Now, sweeteners aren't a total no-no, but you do want to manage how much. And, you know, the ones that give you nutrients will be better. So things like dates or date syrups, molasses, raw honey, and, you know, some syrups, they'll at least provide you with some sweeteners. But this is something you want to limit and really use more like when you're baking or maybe a little bit in your oatmeal. And then there's spreads, which is really, most of these are a source of healthy fats or fats, and these are okay too. Hydration, underestimated. We really need a lot of this. There's a calculation we use, which is half your weight in ounces. And then if you're exercising, 1 cup for each 15 minutes of exercise. And for those who, this might sound like a lot, so at least get to 60, 64 ounces a day. And this includes all, so not just water. It includes your coffee, your tea, if you're having soup. So it might not be as bad as you think, but you do need to hydrate well. It helps all medications work better, including GLP-1s. You also want to kind of test yourself to see if you are absorbing your water optimally. A lot of people will say, I drink water and I have to run and use the bathroom. And that might mean it's just kind of going right through you and not getting into your cells. So what you can do is consume 8 ounces of water, and it has to be an hour away from caffeine or food, and time when you have to you really have to urinate next. And if it's less than 60 minutes, you need help in improving the absorption of your water. If it's over, then you're fine. And ways to optimize your fluid absorption is you might need some kind of electrolyte. Electrolytes are things like sodium, potassium, and magnesium, and they help bring the water into your cells. I've been very into electrolytes lately, especially over the summer when you're sweating. And you can either make your own concoction, or you can buy. There's so many things on the market. I'm not a big fan of the Gatorades and Powerades, but there's some really great companies like Noon, which is a little tablet you can put in your water, or there's even like non-caloric electrolyte, little, water that you can just put in. It's just that. It tastes a little salty, but it's fine. And then just like aiming for every 3 hours drinking water until your body gets used to it. Supplements to help with optimizing your GLP-1s, optimizing the weight loss, optimizing your health, is clearly a multivitamin, because if you're on GLP-1s or you're eating less for any other reason, your micronutrient intake might not be ideal. So covering it with a multivitamin, I think, is important. The probiotics supplement could be good, for that gut health that we just talked about. Protein supplement to get to that, well, I'm going to show you in another slide, but some experts suggest that if you're on one of these GLP-1s, you need 1 gram per pound, which is a lot of protein. I don't subscribe to that, because that could be 150 to 200 grams of protein. It's so hard to get that in. But even if it's not that much and you're not eating that much, it's going to be very, very difficult to get your protein in. So I do recommend a protein supplement usually. And, a nice clean one, not with a lot of sugar, not with any sugar, and a very simple one. You can get pea protein powders. You can get an egg white powder. There's all these options now. It doesn't have to be like a high caloric protein powder. The fiber supplement, maybe, because you might be, with not eating so much, you might get constipated. Plus, with the slowing of the motility, you might get constipated. That might be a side effect of one of those drugs. So a fiber supplement is very important. And then, did anyone ever hear of berberine?
Yes, it's excellent.
Do you take it?
Yes, I do.
It's one of my more favorite supplements, but not because in the social media it's called Nature's Ozempic. That's not why. Berberine is great for lowering blood sugars. It's great for making you feel less cravey. It's good for your microbiome. It really helps improve the short chain fatty acid profile, which is really important for your gut microbiome. So I do like berberine a lot. Omega-3 fatty acids, because that's really important for your gut and inflammation. So if you're not going to be eating enough fatty fish, then definitely an omega-3 fatty acid supplement. And then, because these medications might affect your thyroid, will affect your thyroid, you need thyroid supporting nutrients, which most of these you can get in your multi. So selenium, zinc, vitamin D, iodine, but most of these will be in a multi. So I'm not scared about that. Now let's talk about the medications. So the companies make these to mimic our own natural GLP-1s and GIPs, which we talked about earlier. When they inject, they bind to and activate the GLP-1 and GIP receptors. So It enhances insulin, it reduces appetite, it slows gastric emptying, and that's how you feel full. But some other benefits that they're finding is cardiac prevention. It seems to be lowering LDLs, lipoproteins. It seems to, and I say seem because there's some research here and there, seems to decrease inflammation in the heart. It affects your pancreas by making it stimulate the beta cells to increase the insulin to move that glucose from your bloodstream when you do eat. For your brain, it stimulates leptin, which is a hormone that tells you that you're full. The kidneys, it helps excrete sodium.
You picking up leaves too?
Well, I just put it there
It
because it was
decreases
pretty.
lipogenesis,
Thank you.
which tells your body, I have enough energy, stop storing fat.
I'm okay.
That's a really important one. Cautions, because of the way they act, gallbladder disease, it could affect gall, so you need to get that checked. It might affect fat malabsorption. It could affect your pancreas, pancreatitis. There's been some reports of visual issues, retinopathy, gastroparesis. If you're on insulin, you need to be aware you might have to change your insulin. If you're going for surgery, you have to be off of these medications for, I think it's 2 weeks, it might be longer, because of the way it will slow the anesthesia. It will affect how anesthesia is felt because of the slow everything. So there's a big thing about not having it anytime near surgery. And then because of the eating thing and not eating and people feeling so great about the weight loss, there's worry about eating disorders. So something to be aware of. Very important, if you're on these medications, to prioritize protein and non-starchy vegetables, just like if you were having bariatric surgery. So protein first at each meal or snack. You eat your protein first, you eat your non-starchy vegetable next for the micronutrients, and then if you're still hungry, you'll eat your carb. Weight resistance exercises are so important because when you lose weight fast, a lot of it could be muscle, and you don't want that. As we age, we lose muscle anyway. Muscle makes us, makes us feel good, look good. And if you lose a lot of muscle mass, it gives you a lot of fatigue, and the weight resistance is almost imperative with this medication. So how does it affect cancer? So there are 2 very specific cancers that there's a contraindication for. One is called MEN2, multiple endocrine neoplasia. The other one is medullary thyroid cancer. So that is in the research. And, a lot of doctors are saying, well, if weight, well, let me show you this slide. I'm sure you've seen this before. Because weight is associated with cancer risk, wouldn't this help decrease your cancer risk? So yeah, there's that too. But there's a balance, you still have to eat well. So these cancers have been known to be influenced by obesity, and this medication helps obesity. So I think the jury's out still. I think, they're still finding things, and I think it could be helpful, but I think it could be harmful too. I think there's both. So question. Here is a GLP-1 plate, optimizer plate. It's everything we talked about on a plate. So like you can see half your plate of fruits and vegetables, 1/4 of your plate is carbohydrates, and 1/4 of your plate is lean proteins. And then you have the fermented foods and the anti-inflammatory foods. And the last thing I'm going to show you is a little recipe.
the sound has gone off. I don't know if it's just me.
There was sound with this recipe. Did it come with sounds or is it just the pictures, Debbie? Like the video?
We're not seeing a video.
Oh, you don't see it?
Nope. We're
I
just.
see a video.
I see a
Oh.
video.
I see a video also.
I
But
don't.
I don't think I hear Debbie.
Then turn left.
Okay.
I picked that one because it's a very well balanced meal. It's got the protein from the cottage cheese. It's
Mhm.
got the oats with the grains, and it's got the berries for the antioxidant. So I like that recipe. Okay, go.
If it's okay, there's a bunch of questions. I'm going to just kind of pick which ones seem the most
of course.
relevant. Someone asked, once you're taking this medication, do you have to be on it forever or just until you've reached your desired weight?
I've seen both. Most people are saying forever. That's what I'm hearing. But I know some people who got off of it and they maintain their weight loss, but I personally don't think that they're eating. This is a family member. They're not eating well. They're not eating enough. So, but most people say it could be a forever thing. Yeah.
Maureen said, I joined late, so apologize if it was already discussed, but what are the benefits of taking GLP-1s when you have cancer? Also, can you take them when going through active treatment?
The benefit would be the weight loss because weight loss is associated with some cancers. And treatment, that's something you'd have to talk to with your doctor. In the research, I did see that people did have it with treatment, but I think there's so many variables that you need to talk to your doctor about.
Someone asked if you can share the side effects of berberine.
Some people, when you first started, do get a little nauseous and it does affect your gut a little bit, but most of that goes away after you continue taking it. So it's short-lived. I think it's worth a try. I don't hear too many people having too many side effects.
Can you use pure stevia plant for sweetener in your coffee and
sure,
tea?
definitely. Yes, absolutely.
Any bars to recommend if you're on the run?
I don't like bars. Make your own. There's so many easy ones that you can make with oats and
I know that, Debbie, and that's why I'm asking you again.
You're
It's Robin. I know
It's
you don't
Robin's
like bars,
question.
but sometimes it's just
bars.
easier.
I don't like bars.
Okay, all right. I'll
I
take my
would rather you
leftover
just
meal.
take some like walnuts,
Yeah,
coconut
know.
strips, and
I know.
I'll have to make one.
There was something else. Elisa, you had something here. Will leptin managers, cortisol managers help?
Yeah. You mean for the appetite?
I think so. Alyssa, you had shared, it was a little bit of a more personal, just related to you. So that's why, since we're a little over, I didn't share that other one. But are you asking if the leptin managers, cortisol managers will help in terms of maybe weight loss? You're muted too.
Yeah, sorry, I'm the worst on mute and Zoom and all the things.
That's okay.
Cortisol, and also I apparently have been having a lot of typos today, not round seeds, but ground seeds, and cortisol manager and leptin manager. But
Tell me what cortisol manager you're on.
what?
What cortisol manager are you on?
I'm not on it right now because my thyroid, I've been trying to switch up my thyroid meds because my thyroid isn't working correctly right now. And I also have chronic insomnia. So it's like I just keep gaining weight. I'm always exercising, I'm intermittent fasting. I'm so frustrated.
Sorry. I
tried the GLP1s and I didn't lose any weight on those because I could only be on it for 3 months because I had procedures coming up that I needed anesthesia for. So I need like a good long-term.
Yeah.
Like,
I mean, it's possible. I just can't do it now, but it is possible. And just because you mentioned cortisol, I love ashwagandha for decreasing cortisol. It's natural. There is some thyroid, but I take it and I have thyroid issues, but that's a natural way to decrease your cortisol. Leptin, is that a medication you're taking? Because I don't know of a supplement that increases leptin.
It's just called leptin manager. I also have.
Is it like over the counter?
Hold on, I think let me just go grab it.
Any other questions while we're waiting?
I think the last
Um,
one is Sherry, whose hand is up. So she didn't write it in the chat. Sherry, are you there? I do see that you're outside and you are muted.
By
Yvette also has a question.
it's
Yeah.
by XYMOGEN.
Zemogen. It's a good brand. At least I know that.
Oh, good.
Yes,
So that
it's
is a
a
good
it's
brand.
a very good brand. Yeah.
Okay, good.
Sherry.
Yeah.
I'm
And then
just
Yvette.
wondering, are you going to make the slides available?
Yeah, this is recorded, and then I thought also I would send the recipe for the video that if you want it. And I thought I would
Yeah,
also send the plate, maybe. I don't know. What else do you want from there? I could send it separately.
I'd love the slides.
Okay, sure. You got it.
And then
Thank
I guess the
you.
other thing I guess is the microbiome. How I went through a thing where I was like trying to measure my microbiome and I did that whole test and it came back and it was just awful.
What did you
And
use?
then I don't remember. It was right after treatment because I wanted my immune system and the
Yes, no, I think it's
microbiome.
so important. I use
So
a company called Vibrant America. I love their stool sample because it's very comprehensive, not only for digestion, but also the family of microbes. So I do think I do like them. And as long as, like, who did you do it with? Like, you need to do it with somebody that can really evaluate it and give you the proper diet and supplement regimens to go with it.
it probably wasn't the right person, so
Yeah.
I probably need to revisit that.
Well, I'm in New Jersey, and if you guys are interested in, a one-on-one, or if you want stool sampling, we take a lot of New York insurance. So that might not be a problem. If you guys are on Medicare, though, we do take Medicare. That's not the problem, but they don't cover much. They only cover for diabetes and renal disease. But, I would be happy to work with any of you if that's what you're looking for.
That's great.
Thank
Thank
you.
you.
Yvette did have a question in the chat. I'm sorry I missed it. Yvette, do you want to ask your question?
In the news, last few days, it came out that plant-based milk is linked to colon cancer, and I just want to know if there's any specific ones that are safe.
So there's two things that I want to mention about that. One, it might have been the carrageenan. I don't know. Maybe I don't know, because I'm not surprised because there's a whole bunch of stuff in plant milks. I like the really clean ones, like Califia has a really clean one. When it says just almonds and water or oats and water, I'm okay with it. But I'm also finding, like, the chickpea pasta that I mentioned before. I really was a big proponent of it, but I'm starting to step back a little bit, because when you eat chickpeas, normal portion, you eat the chickpea. But when they grind it, and it's almost like the difference between eating a fruit and drinking the juice. When you drink the juice and eat the fruit, even in the same portion, you're getting so much more that fruit. And the same thing with the garbanzo beans. You're getting so much of it. And if it's not organic, which I haven't really found too many organic chickpea pastas, then you're getting a lot of whatever pesticide is on it, or whatever. So it's like so I'm a little wary when it's even processed. Remember how I said processed foods are okay? It could be okay, but if you're just having too much of one thing, it's not usually okay. Does that make sense?
I think it does. Last question for Janet, and thank you for staying longer than expected.
I know it's late. I just have a question about carb cycling, because I've heard that could be good. I need to lose maybe like 8 to 10 pounds.
So you mean like eating and avoiding, eating and avoiding?
Yeah, sort of
Why
mixing it
not?
up.
I'm fine with that. I think so to me, cycling means like different, and I like different. There's another term called seed cycling. Do you ever hear of seed cycling?
No.
I like that too, because it's a bunch of seeds that you're having, and intermittently, and it's for hormones. I just got into that, not for myself, but for some patients. And so I like the whole concept of cycling, because that means variety. It means different things.
So you do it like
Take it up.
every other day, right?
Great.
Or
I don't really know. I've never
no set way.
taught that, but I
Okay.
think I like it, because you're
Okay.
not avoiding it, but you're just changing the times. Shaking things up is always a good idea.
Okay. Thanks.
You're welcome.
Thank you. Debbie, thank you, thank you, thank you, thank you.